Hi, I'm Dr. Natasha Bhuyan. I'm a family physician at One Medical, and today I'll be answering the internet's questions about sexually transmitted infections. Can STIs be transmitted through kissing? Generally, no. It's very, very low risk to transmit STIs through kissing. There are some very rare instances when you can. So things like syphilis or herpes that causes cold sores, and even HPV, there's rare instances that it can be transmitted through kissing, but I tell people it's a super low risk activity and kiss away. What is the difference between STDs and STIs? STI stands for sexually transmitted infection, and STD stands for sexually transmitted disease. Back in the old days, we used to call STIs sexually transmitted diseases, but we found they're not actually long-term diseases. Most of the time, they're infections that we can easily take care of. If somebody does get an STI that turns into a longer-term disease like HIV, then we can refer to it as an STD, but for the most part, we refer to STIs as STIs these days. Can STIs kill you? Unfortunately, there are some STIs that if you get, in the long run, they can kill you. For example, HPV is an STI that can cause cancer, and cancer of the anus, of the cervix, of the mouth. All of those things are things that can ultimately end up killing you. HIV is also another sexually transmitted infection that, if untreated, could also kill you. Why do STIs exist? This is a very existential question. Really, around our bodies, there are tons and tons of microbes and bacteria, and it exists all around the world. And some of those bacteria are good and some are bad. Some of the viruses are good and some are bad. And we find that for some of the bad ones, they can end up causing havoc on our bodies, and so we just need to get them treated. But it's pretty normal to get STIs. They are really just infections that exist in the world anyway. Do STIs hurt? There are some STIs that can cause pain, and there are some STIs that will cause no symptoms at all. For example, chlamydia and gonorrhea can cause pain when you urinate, but chlamydia and gonorrhea can also cause no symptoms at all. And so if you are worried about having an STI, it's great to see a doctor to get tested. And really, even if you're not worried about having an STI, if you're someone who's sexually active, you should get regularly tested and screened for STIs anyway. Can STIs cause UTIs? No. The bacteria that causes UTIs is different than the ones that cause STIs, but they can present in the same way. For example, if you have burning when you pee, that could be caused by chlamydia or gonorrhea, or it could be caused by a UTI bacteria like E. coli. The mechanism is a little bit different. STIs cause inflammation in our urethral tract where pee comes out of, whereas UTIs are actually causing an infection in the urine. But the symptoms ultimately can be the same, so it's important to make sure you're able to differentiate them. Why is chlamydia so common? Chlamydia is so common because it's so easy to pass from one person to another. We see it in both males and females. It tends to end up being in females quite frequently because our urethral tract is a little bit shorter, and so it's easier for the chlamydia to just crawl up our urethral tract. How does gonorrhea affect the body? Gonorrhea can affect our body in lots of different ways. In some people, they might not feel any symptoms at all. In other people, they might feel burning when they pee. They might have discharge from their pee hole in both males and females, or they might even get itching in the pelvic region. Will an STD test show herpes? No, the general STI panels do not test for herpes. The herpes blood test is very controversial, and it's actually not very helpful. A herpes blood test could give you a false positive, or a herpes blood test might show you've got antibodies to herpes, but we don't know how long ago that you had the infection. So we really discourage people from getting a blood test for herpes. However, if you have a lesion on your genitals, you should get that swabbed, and we can swab that for herpes and test it out. Generally, herpes lesions are quite painful. If you have a painless lesion on your genitals, you should get that tested too. Painless lesions on the genitals could also be a different STI, like syphilis. People can have herpes and not realize they have it, but the reality is when people get herpes, they will get painful lesions. Will an STI test show HPV? No. Again, a general STI panel tests for gonorrhea and chlamydia, HIV and syphilis. The way that we're able to test for HPV is when you get a pap smear, we can look at those cells and we can see the HPV DNA in those cells, and that's how we diagnose HPV. Will STIs show up in a pap smear? You've got to ask your healthcare professional to add STIs testing to your pap smear. It's possible to run gonorrhea and chlamydia in a pap smear and test for that, but we specifically have to order it. So we want you to feel comfortable to tell your healthcare provider to add on those STIs when you get a pap. Blood tests like HIV and syphilis, though, those do not come up in a pap smear. You'll have to get a separate lab to get those tested. How do STIs affect fertility? It's very important to get tested and treated. If STIs go untreated, they can actually impact your fertility and they can make you infertile. This doesn't happen commonly, but gonorrhea and chlamydia can get into your system and cause a condition called PID, pelvic inflammatory disease. What happens then is they'll scar the fallopian tube. That's the tube that is in between your ovaries and your uterus. And when they scar the fallopian tube, it makes it hard for an egg to pass through, and it can affect your fertility. It's similar in men who are cisgendered. So men who have testicles can get an inflammation of this thing called an epididymis, which is a tube behind the testicles. And if they have untreated gonorrhea or chlamydia, that can become scarred as well. How do STIs enter the body? STIs enter the body a couple of different ways. They can enter through fluid transmission. So STIs can be in semen or vaginal secretions or blood. This is why we tell people use a condom when you have sex, because it reduces the risk of transmission of STIs. STIs can also be passed with skin-to-skin contact. So something like herpes is passed with skin-to-skin contact, and condoms do reduce the risk of this, but your skin can still touch and you can still get herpes even if you're using a condom. Which STIs can be treated with antibiotics? The bacterial STIs can be treated with antibiotics, so that's gonorrhea, chlamydia, and syphilis. There's another STI called trichomoniasis. It's this little parasite that has a tail, and that can also be treated with an antibiotic. Which STIs have no cure? The STIs that have no cure tend to be the ones that are viral-based, like HIV, although there's lots of treatments to manage that condition. Hepatitis, same thing, lots of treatments to help manage that condition. Herpes is another viral STI that doesn't have a cure, but there are medications to keep recurrence at bay. So if you are worried about having an STI, you should see a healthcare professional because we can help figure out if we've got a cure for it or if we've got something that can help manage it. Will STIs show up in a blood test? The STIs that show up in a blood test are HIV and syphilis most frequently. The ones that come up in a swab can be gonorrhea and chlamydia, as well as herpes. And you can also test gonorrhea and chlamydia through a urine test. So there's lots of different ways to test different STIs. STIs are really common. They affect millions of Americans and lots of young people. We want to normalize sex in our culture and be able to feel empowered and take care of our bodies. If you're worried about having an STI and you want to get regularly screened, please see a primary care provider. We are more than happy to help you.